yes, you can freeze your eggs. Fortunately, we are in the era where we have had a recent development of vitrification. We have been freezing eggs from a long time. However, from the last decade, the new process of egg freezing by a fast freezing process of vitrification has enabled us to give a lot of women a very reassuring option of freezing eggs. You might want to consider freezing eggs if you are suffering from an illness like a cancer, whereby you need to undergo chemotherapy, which can affect your fertility in future, or even women suffering with severe endometriosis, where you have to undergo surgery to get a relief from it. Egg freezing is a good option. Other category of women who go for egg freezing, largely called as elective egg freezing or social egg freezing, is if you are wanting to delay your fertility because of having to have an option in your career, or you're not with the right partner at the moment. You don't need to rush into a relationship. You can actually freeze eggs to give yourself that a sigh of relief and not have that pressure off on you. Other category I would say is women having transitioned to male to have an option of biological children in future. Egg freezing is a good option for yourselves as well. And also women who are in life-threatening jobs like in armed forces or deployed to go to the borders. Egg freezing would be a good option for you as well. The egg freezing process involves, of course, first step would be to see a physician, to make an appointment to see your consultant. You will undergo first will be assessment of your ovarian reserve, your medical history, your ovarian reserve. Ovarian reserve assessment includes a transvaginal scan to look at your ovaries and count the number of follicles, which will give the current status of your ovary, and to do a blood test of anti-Müllerian hormone, which also then tells us what is your current fertility status. Following that, once we've got the fertility status, protocol is made that is just the perfect one for yourselves. You will see the nurse who will carry out some blood tests for you, including infectious screening of HIV, hepatitis, and so on. Once all that is done and it's clear, infectious screening is not to check your ability to freeze eggs. It's just to know that if we need to store your eggs in a different away from the others because of the risk factors. Once that's done, you start your medication, which is gonadotropins, which is roughly around 10 days to 2 weeks time. You will be injecting yourself. We monitor you by doing transvaginal scans and checking your estrogen level in your bloods. Once we see the follicles are ready, then we do the egg retrieval, which is done by using a transvaginal ultrasound guided aspiration, which is done under sedation. It's usually a 15-20 minutes process. Yes, everyone can freeze their eggs. It is slightly tricky to say when and when you should freeze your eggs. It does depend on your ovarian status and what is your current ovarian reserve. And of course, the final outcome of egg freezing is dependent on your age. So number of eggs and the age at which you froze the eggs are the two important parameters to know the outcome of the whole process of egg freezing. Everyone can, once we have some eggs to freeze, once you've had your ovarian status assessed, we always say the younger you are, the better the outcome will be for your frozen eggs. So I would really recommend that if you are normally women when they are in their early 30s should start contemplating or thinking about if you want to do it, and that would be the right time to take a action if required, or start thinking about egg freezing to get the best possible outcome. Yes, you can freeze your eggs after 40. It is quite a tricky question because it's very difficult to assess biologically how well someone will do with the process of egg freezing, because there's so much of variability, person to person variation, and how your ovaries will age or how your eggs will age, because that's such an uncertain factor in egg freezing. We don't come to know till we have thawed those eggs and we've created embryos to see what the embryo quality is. We can freeze eggs after 40, but we have to understand that there are studies that show, and there's clearly something we know, that the quality of the eggs decline, and therefore the outcome might not be as good as if we did it earlier. And of course the number of eggs also becomes fewer after once you are 40, and therefore you might end up doing more than one cycle, multiple cycles, to freeze the desired number of eggs to get a reasonable outcome later on. The standard period for which eggs can be kept frozen is a maximum of 10 years. However, there are certain conditions or circumstances in which they can be stored up to 55 years. Conditions like if you're likely to be prematurely infertile due to treatment of chemotherapy for cancers. Your clinician can help you decide which category, or help you extend your storage if you fall into the category where it is eligible. But it is very important to understand that at the moment, for social egg freezing or for elective egg freezing, the maximum storage period is 10 years. The cost of freezing eggs is very variable. It does depend on your age, and I come back to the ovarian reserve, your ovarian status. So someone who's younger or in early 30s and has got a very good ovarian reserve, we're likely to do only one cycle, and we'll get the desired number of eggs frozen in one single cycle to have the best possible outcome later on. And someone who does it a bit later, say in late 30s or 40s, might have lesser number of follicles, lesser number of eggs collected per cycle, and therefore we would recommend them to do a batching cycle. So do 3 cycles and batch and collect eggs from each cycle. So you can imagine the medication used will be 3 times, and the cost will be much more for a person who's doing later on than to earlier on. The amount of medication used is less. So because of the variability of every individual and the variability of number of eggs collected, the amount of medication used, the costing is different for every individual. We take everyone as an individual person, so everything will be kind of tailor-made for yourselves, and therefore it's very difficult to give you overall costing for anyone.